I was just thinking about a quote by, in relation to maternal mortality, a very famous quote by Prof. Mahmoud Fadala, who said, he's an Egyptian professor, that women are dying not because we do not know what to do. Women are dying because we have not yet decided that their lives are worth saving. Hello, my name is Angela Muriuki, and I'm the Director for Women's Health at FIND. I'm joined today by Anouk Petersen to discuss this groundbreaking report that was released at this year's World Economic Forum. Would you like to introduce yourself, Anouk?
Sure. Hi, Angela. So my name is Anouk Petersen. I'm a McKinsey partner from Geneva, affiliated with the McKinsey Health Institute, and I'm a co-author of the paper we released a month ago on closing the women's health gap. And at McKinsey, I lead the women's health work across life science, philanthropy, public health, and it's a pleasure to be here.
Now, the findings in this report were equal parts surprising, but not surprising, in the sense that there's a lot we already knew. From your perspective, what would you say was new and what affirmed what we already know?
Thanks, Angela. You're absolutely right. We've known that there is a gap between men and women in health outcome for quite a long time. What we think is really truly new is first the fact that we took a holistic lens to women's health, and we both sized the gap in terms of health outcome by taking this holistic lens, and we took also we gave an economic price to it. So these two elements are really truly new and had actually groundbreaking realization of that, the size of the gap. We know that for a fact that women live longer than men. We have a higher life expectancy on average. However, we spend 25% more of our lives in poor health. And the second myth is, or things that come to mind is, oh, but all of these years come at the end of life where economic impact might be less. And actually, this is not true. 60% of that burden or that gap comes during years where women are active. And the premise of the economic impact is based off poor health impact women's ability to be their best self at home, but also importantly at work in the communities they are operating, and at that gap, economic gap translates into roughly 1 trillion. And the last piece, as you said, what is new? We've tried also to create a bit of a framework for everyone to think about that gap and to focus on what can be done to close that gap. And I think what is new is also we helped identify what are the key drivers of this gap, and we believe they are fourfold. One is the lack of or the limited understanding of the sex-based differences in basic science, very important. The second is the constrained access to sex appropriate care, gender-based care. The third one that we stumbled upon the whole time we were doing research is the data gaps. Everywhere it's undercounted, underreported, non-existent. It feels that women have just been an afterthought in so many of these processes. And fourth, obviously the lower levels of investments that are limiting both innovation and scale. So we hope that these levers will help everyone focus their efforts to help close that gap.
Thank you. And we'll come back to those four aspects that you've mentioned, because I think it'll be important for us to grasp or to get some key practical things that we could do to cover these gaps, as you recommended in the report. But I want to now go into an area that the report really emphasized on, and this was the gap in accessing diagnostics or getting accurate diagnosis for their conditions. You gave some really great examples of the years women spend in poor health because of undiagnosed conditions. Could you elaborate more on that?
Absolutely. So one of the myths also that we try to debust is that women is actually broader than just sexual and reproductive health. While sexual and reproductive health is very important, 95% of the burden stem from conditions that both men and women have in common. And out of these 95% conditions percent that we have in common, more than 50% is for conditions that are either more prevalent in women or different in women. And these two are, if I think about the more prevalent in women, I will think about autoimmune diseases, for instance, migraines, Alzheimer's disease, where women are actually the majority of the patients. But I will also, in the different in women, I will think about all of the cardiovascular examples that we hear more about these days. So while these are vastly different, yet historically men have been both leading and been the subject of both medicine and biology. So these male-centric models of the diseases contribute to delays in and lower quality of care for women. If I just give one example, the cardiovascular example is women are 7 times more likely than men to have a heart attack misdiagnosed. So that's one element. There are other barriers for women when accessing diagnostics and accurate accuracy of these diagnostics. Those are, as I mentioned earlier, the lack of understanding really of how these diseases manifest differently in women. All our care systems are designed to around male manifestation of the diseases, and will call women symptoms atypical. While as you may hear, those have huge implications on how care is delivered. So the lack of understanding of how these diseases manifest differently in women, the simple lack of tools to diagnose our conditions as well, and the systemic also biases that are in the care systems when women enter. And I'm gonna take the example. There is also a growing body of evidence, for instance, that when it's related to pain, so women's pain are routinely investigated, undertreated, and these have implications, as you may well think, on diagnostics and clinical outcomes for women. I know also at Find you're very focused on female-specific conditions, and when we look at female-specific conditions, we see that proportionately women bear a much higher share of specific conditions than men. So men have very few conditions that are really only specific to men. And yet we do bear a higher share of that burden. When we look at availability of diagnostics, availability of treatment, the level of unmet needs for women remain huge. If I think of one example, the prostatic hyperplasia is a disease that roughly affects 2% of men, which is a men-only condition, will affect 2% of men. And if I take the example of endometriosis, that roughly affects 10% of women in reproductive age, if you look at the landscape of diagnostics and treatment, you will find it takes just a few weeks to diagnose benign prostatic hyperplasia, and there is treatments existing for that effect. And if you take endometriosis, on the other hand, 10% of women in reproductive age, excruciating pain every month for multiple years, and it can take up to 10 to 15 years to diagnose. There is no proper diagnostic tools, and even when it's diagnosed, there is no treatment, barely a symptomatic treatment. And if we take that lens even further, if I think about low and low middle income countries, this problem will just only exacerbate because of the limited access simply to existing diagnostic tools and treatments overall.
Yeah, and one of the reasons you mentioned that came out in the report as well was the fact that there's been a lot more focus on sexual reproductive health, and you mentioned that only 5% of burden of disease is attributable to these female-specific conditions, and particularly sexual reproductive health-related issues, and the other 95% is on the other broad issues, conditions that affect women differently or disproportionately, or general conditions. One would argue, I spent my entire career in sexual reproductive health, so I could argue that even sexual reproductive health is not adequately funded. So would this then start to draw, because you know what happens in global health, that money tends to move to where the noise is. So would this then move resources away from an already under-resourced area? I'd like you to reflect on that.
Angela, you're absolutely right. Sexual and reproductive health is critically underfunded and requires continued attention. We also believe that it's very important to paint the full picture around the women's health burden, hence the 5 and the 95. And by the way, the 5% is very likely an underestimation of that. However, regardless of what is that percentage, we believe there is a kind of a big other part of the burden that stems from these conditions that are different and disproportionate in women. I think the argument or the perspective that focusing the attention of this different in women or disproportionate in women is a bit of a zero-sum game thinking.
And there's a phrase in the report, I may paraphrase it, that I absolutely love, that should be on a t-shirt, that the solution is not to cut up this small piece of the existing pie. The solution is to make more pie. So hopefully that is the message that goes out, that we need more pie. Now, talking about the economic case for investment, you had some really great examples of comparative return on investments that the private sector should consider on why invest in some of these underinvested areas. Could you give some of these examples?
Yeah, so I mean, we took the economic lens, and one of the conclusion was that for every dollar, every unit of currency invested in women's health, there is a $3 return on societies, and those span from women being less sick, dying less early, being productive workforce, but also there is an entire lens around women are today still the majority caregiver in most societies for younger children, but also for elderly. And that by improving women's health, we improve also the half of the population's health, hence potentially needs less of that care and frees up resources for also women to decide how to reinvest that time that today is purely unpaid labor.
Femtech. What's the opportunity, and what more should the femtech industry be looking at?
First, what we want to celebrate is also now the spotlight on femtech and the level of investment that we've seen have steadily been growing. However, when we compare that sheer volume of investments compared to other areas of health, we always hope that they would be higher. But we believe there are true opportunities when products hit the market, and when we see that product hit the market and answer parts of the needs, not all needs, but parts of the needs that women face, we see actually huge uptake. And we've had recent example on menopause ecosystem, digital engagement for women that have been raising money, that have had an engagement increase from a few hundred to a few million women in the span of weeks, just really showing that there is a need that is unmet there. So hope that all areas around menopause, of course, around menstrual health are critically important as well, and those we see a channeling of funding that we think is exciting.
So under those 4 buckets, could you give us some recommendations on how we get started? Again, because the gap and the investment needed is huge. So when you read it, it gets really overwhelming. So breaking it down to something that feels
tangible.
doable.
Thank you.
Yes.
You're absolutely right. This task feels daunting. However, we believe truly that this gap is addressable. And as you mentioned, how can we bring that huge number into something a bit more tangible? If we want to translate actually that number, we are talking about 75 million years of life lost to poor health for women every year. And if we translate that into number of days per woman per year, we are roughly at 7 days. So we are talking about 7 more days of healthy living every year for every woman on this planet. So this is obviously a huge opportunity that comes along with actually a full ecosystem play.
Now, the data issue, because ultimately without data, we are still flying blind, we're still moving blind. What recommendations would you give around addressing this massive data gap?
You're right, and we see it everywhere. The women lens. I mean, first, our societies are also collecting mostly economic data, and because women have a lower usually participation than men, by essence, that bias exists at the very essence of how we collect data. The way we are thinking of it, of course, is. There are ways we can increase transparency. I mean, policy can play a role for promoting more sex disaggregation of information that we have at hand, but that is not made public. There are ways also of, because of, as you said, right, having a good base for data is the basis also for investments. So investments will be based off data, and when these data are biased. So I think is starting to shed light. It's understanding where these gaps are and starting to shed light on those. If we are like in the course of our report, we've identified, for instance, that very reputable sources of information and data that everybody uses were systematically underrepresenting menopause. Instead of using roughly 90% of women going through level of symptoms, they were using 30%. So by raising these one by one, category by category, and that institution, as we speak, is changing that methodology. So it's going to be an effort from everyone, but it's crucially important to point out where do we have those gaps, because decisions are being made on these data that are usually flawed.
But I was just thinking about a quote by, in relation to maternal mortality, a very famous quote by Prof. Mahmoud Fadala, who said, he's an Egyptian professor, that women are dying not because we do not know what to do. Women are dying because we have not yet decided that their lives are worth saving. And when listening to this and the data that you're presenting, it feels like it's the same thing.
At some point, it also boils down to more women in leadership positions. All of these investments, all of these decisions are made somewhere around tables that are today majority men around the table. And while many important decisions are taken, I think more women representing the interests of women, have a higher understanding of these issues, will help change the winds.
And the fact that this year's International Women's Day is about investing in women, the one I keep forgetting. And maybe we need to get more than a day to talk about these issues and have a month or several months, because we start a momentum and then the rest of the year is gone. But
we need 52% of the year to be talking about women. Fully agree, and one day feels a very symbolic one. But let's use that opportunity to create awareness around the world.
It's a start. Thank you so much, Anouk, for joining me, and thank you for the work you did on this report. It truly is groundbreaking.
Thank you, Angela, for inviting me. A real pleasure.